Hello and welcome to Talking Treatment, the podcast for everything in the field of mental health and addiction treatment. I am your host, Derek Dorado, and join us in listening to our episode as we will focus on highlighting industry trends with guest experts and healthcare providers from around the nation in the treatment industry who will share their unique perspectives on treatment. Ending the stigma on behavioral health and substance use disorders is very important to us, and the easiest way to do that is by talking about it, and that's talking treatment. Today we have a special guest from Dove Recovery House in Indianapolis, Indiana, Wendy Noe. Wendy?
Hi, thanks for having me.
Very grateful to have you today, and we're glad that Dove Recovery has been around, and y'all have been around since 2000, is that right?
We have been, yes. We look quite different than we did when we first opened up, though.
And how long have you been with them?
So I've been here, it was 5 years in December. To give you a little back history, when we were started because of a woman's personal passion to help other women recovering from addiction. And here in Indy, there really wasn't anywhere for women to go for substance use disorder in terms of like recovery residences. And so it was about 8 years ago when we really started to develop a program. So groups, some one-on-one therapy, case management. And then when I came on just over 5 years ago, we were still kind of a halfway house, a sober living environment with some programming. And I come from, large nonprofits and where we have lots of policies and procedures and processes and data collection and, but also we needed to be financially stable. Our budget was about $250,000. We weren't tracking anything. And so really it was, how do we best serve our clients? But also how do we best share our story about who Dove House was? Because the reality is people didn't really know about Dove House. I mean, we were not branded. We were not electronically strong. So we did not share files anywhere. We were recreating documents. We weren't tracking length of stay really. We weren't tracking outcomes. So, and then for me to do a lot of research about best practices to understand what's the evidence support and how can we be aligned with national standards.
Okay. Okay. And what did you do to kind of bring Dove Recovery House into that 21st century?
We became branded. We were very clear about how we were going to document information and be confidential and, but ultimately, how do we best serve our clients? We were in a very small facility that was very rundown. And so one of the first things I did was meet with the board of directors to discuss what's next for Dove House in our evolution. And through that process, we were able to secure a 10,000 square foot building that was donated to us. Wow. We raised $1.3 million to renovate it. So we are now on one of the busiest thoroughfare streets in Indy. So we get a lot of public awareness that way. But it also allowed us to increase our capacity by 60%. So in 5 years, we've gone from serving 23 women a night to 40 women a night, a staff of 6 to a staff of 15, a budget of $250,000 to over $500,000. So being very intentional about how do we serve our clients and how do we ensure that we can remain sustainable so that we will continue to exist for years to come and not struggle to serve our clients the best way we know how.
That's fantastic. I think your efforts to really be more forward-facing in the community and having that location and all the efforts and being transparent with your data and tracking has been critical for Dove Recovery House's revival. It wasn't so long ago that Dove Recovery House wasn't in a great financial position, right?
Correct. Yeah, we were struggling. When I first came on, we were taking out on line of credit to make payroll. I did not inherit a donor database, and we're a 501c3. We're a nonprofit. We depend solely on the generosity of individuals in our community. It's really only been within the last 2 or 3 years that we've had any support from other funding sources from either the city or the federal government. So our existence was on the generosity of individuals. But for me also, I've always worked on women's health issues and nonprofits. And for me, it was urgent that we begin to change the narrative around addiction. and
Yes.
that there were women in our community that were dying from their disease because they didn't have access to care. And for me, I knew, and doing the research, because addiction was not something that I specialized in, I really wanted to understand addiction. And in talking with our clients and learning their history, we knew that trauma was at the basis of everything. It was the core of who they are. I mean, my clinical director and I now do a workshop called Trauma is the Gateway Drug, because we know that a person doesn't wake up addicted. And so for us, it was really being intentional about sharing or changing that narrative and helping people understand that these are individuals that we love and that we care for. They're someone's daughter, friend, mother. And only can we begin to conquer this disease is only when, as a community, we can come together to talk about it and find solutions. And so that's absolutely what we've done. We've changed the face, or we're working to change that face and help people to really truly understand that a woman with substance use disorder deserves to be treated like any other person with a chronic disease. And the women that come to us are our most vulnerable. They're the ones that are living without health insurance, that have experienced homelessness. 95% have experienced some form of early childhood sexual abuse, and then that abuse only continues into adulthood. So, you know, these are women that have been a part of the sex trade industry, that have grown up in the foster care system. So really understanding and identifying their own unique needs and not being a cookie cutter program, and also being free to them. I think that's a big thing about Dove House, is that we don't charge our clients, because we want them to be able to focus truly on their addiction and their traumas and get healthy. And so for our program, it's a 90-day commitment, but they can stay with us for 2 years.
Well, you know, Wendy, I'm glad you brought that up. I think that you've obviously, I'm glad you touched on the clientele that you serve and the families that you're able to help and support. You've also built an incredible culture, a recovery culture, for you to be open for so many years, you know, since 2000, and to be doing the work that you're doing and having the success, the outcomes that you're seeing. I think is very important. Do you mind talking about Jillian's story a little bit? I think that was something powerful that I read on your website, and really speaks to the different stories of recovery that you have at Dove Recovery House.
Yeah, so Jillian is one of our success stories. She came to Dove House. She had been through multiple programs before, none of them sticking. Jillian began using at a very young age, was introduced to it by a boyfriend, and had experienced childhood traumas. So she quickly fell into addiction. Her mom actually had heard of Dove House and wanted her to get into our program, and finally Jillian was ready and came to us. And Jillian was a tough one. She struggled. She had a son that her parents were raising. He was a little guy. And, you know, Jillian went hard, and she went fast, and she had a couple of relapses, and we don't discharge from our program for relapses. We really thought if she left and she relapsed, we thought we would lose her, because it happened at least 2 other occasions. I think Jillian had a total relapse of 4 times while in our program. She just could not get the hang of it. She was trying to run her own program. And so finally I said to my staff, we've got to do something different. What we're doing is not working. And we sat her down and said, from now on, you have to trust us, and you have to give up your power and control, because the decisions you're making are not working. And so we set her still. She had extremely limited outside activities for about 6 months. We just kind of shut it all down, because what we had been doing it wasn't working for her. So she sat still for about 6 months and really just gave her life over to us and let us really just find out what made sense for her. I think that's what is so great about our program, is that we're not a one-size-fits-all. Every client that comes in is unique. Jillian completed, I think it was around 2 years in our program, successfully discharged into our Steps to Success program. That program was funded by a grantee or a grantor. We do not currently have funding for that program. We're hoping we can get that reinstated, because it was such a tremendous program. But what it was is she entered into that program. She found an apartment in her name, and we provided 8 months of rental subsidy. So for the first 4 months, she received 50% of her rent from us, and then the next 4 months, 25%. And then that entailed or required her to meet with our peer recovery specialist. We did random urine screens, and she had to come back for relapse prevention group twice a week. So we had an additional 8 months with her having that level of accountability. And she is thriving today. She is helping raise her son. She is sober. She's living independently. She is housed. She's just remarkable to see, to think that we weren't sure she was going to make it. We really thought we might bury her. And to see how she just has completely blossomed and become the woman that she's meant to be, and now mentoring the other women that come through our program. We always want our alumni to come back to show that this program can work if you want it to.
That's great. You know, what an inspirational story. It shows, I think you might have said, about 25 different things that sets you at Dove Recovery House apart from other facilities. But, I'll just recap them a little bit. You work with women only, right? That's your only clientele. Is there an age range?
Just have to be at least 18.
Okay. Yeah, I saw there are some requirements for admission on your website. I really did like that. So our ideal client is 18 and over, women-only facility. I think something else that, if I could recap, and I want the listeners to really know, is that a longer length of stay for any client at any facility is going to dramatically increase the likelihood of success and recovery and sobriety.
Absolutely. I think it's like 40%, you're 40% more likely, might even be 60% more likely to remain sober if you are in a program for around 6 months. And so
we have to do that longer stay. Absolutely.
And so we really encourage our clients. We may say 90-day commitment, but if they're coming to us at 90 days ready to leave, it's probably not going to be a successful discharge. So, and actually our average length of stay is 6 months.
That says it for me. Enough said right there. With a longer length of stay, you're going to have a better outcome for that client. And let's talk a little bit of family involvement. You had mentioned the entire family, a dynamic of dealing with Jillian's story, with the mom, dealing with the kid and living situation. I mean, how are you tying in this family involvement, since it is such a crucial step in recovery?
So we actually don't communicate with family unless we have permission because of client confidentiality, but Jillian's mom especially was very involved, checking in. Jillian had given us permission. We were a team, and Jillian's mom trusted us to make some hard decisions. And when Jillian relapsed, we were always in communication with one another, and her mom was supportive and understanding. And Jillian's son, when Jillian was healthy, we reintegrated him back into the program. She had visitation. She could have overnights with him here. When she was a higher level, she could have overnights with her mom and dad. So whenever possible, it's all about team support. Now, I will say that's a lot of our clients that come into our program don't have active family members in their lives. Some do, and we cherish that. But for many of our women, we become their family. We always say is we work in their home. For many of our clients, this is the first safe place they've ever had, or the first place they've ever been able to go to without any expectation other than them to focus on themselves and to get healthy. They have nothing else that they have to give back to us. So that's incredible. But in terms of family and kiddos, we want moms to reunify with their children if that's what they want. They can have sleepovers. They come visit. Our reunification rate is about 65%.
Wow. And are you an abstinence-based program?
We are not. We accept MAT. And we've been accepting MAT for 5 years now. We started with Suboxone for pregnant clients. And then again, as the evidence shows, there's a lot of research that supports MAT. So we absolutely allow clients, we look at MAT as being a component of their treatment plan. If it's not something we tell them one way or another they have to do, it's a personal choice between them and their provider, because we are not a medical provider. But we believe that it's not only and, it's only with. They have to, if they're on MAT, we strongly believe that they should be having inpatient or outpatient treatment services as well.
Right, absolutely. And the state the states, the payers, the government is actually embracing that. And in certain states, it's becoming a requirement, Wendy, which is fantastic. Couldn't agree with you more. And I'd like to give you a shout out and a little round of applause for embracing medication-assisted treatment right now and even in the past, because you have to meet the client where they're at, right?
Absolutely.
And I said it in the last podcast, and I'll say it again, you cannot treat a client if they're dead. And that's very sad and heavy to think about, but if they're not alive, how can you treat them?
I think I come from a unique perspective. I think a lot of halfway houses and recovery residences were started because of individuals in recovery themselves that follow 12-step principles, and we do. I mean, our clients are required to go to 12-step meetings. They're required to have a sponsor, but it's more about them having accountability and ownership. But for me, I came from nonprofit world. I'm a fundraiser. I believe in evidence-based practices and policies and procedures. So I think I look at things a little bit differently, and I think that has helped Dove House kind of break the mold on what perhaps a recovery residence looks like. And we are a nonprofit with standards and processes and look at each client's needs. And if there's evidence and research that supports something, then you better believe we're going to be implementing that here in our program.
Do you hire from the community? Do you hire women that have gone through your program at all, Wendy?
We sure do. Yep. We actually, we have resident advocates because we're a 24-hour, 7 days a week staffed operation. So a lot of our resident advocates are clients. Good majority of them are in recovery themselves. I would probably say 90 to 95% are in recovery. We have a good handful of them that have graduated from our program. And actually, one of our resident advocates is about to get her certification in peer recovery support as a peer specialist. So our goal is, or the plan is, we will be hiring her once she becomes credentialed as a peer specialist. Yeah. I have a rule that you have to have 2 years sobriety, and you have to live outside of Dove House for a year before you can come back and be hired, because it's all about boundaries, and they need to be removed enough and living outside in the real world to be ready to come back and give back. But it's one of the best things about, the women that come here and work, that they've been through our program and can really be translate what happened to them and how it works. And honestly, we've got a couple of clients in it. They were tough ones. It's usually the tough ones that always come back that are just incredible. But a couple of ones that, had a relapse here or there, or struggled, but now are just thriving in their lives.
I don't know what else could feel better than that, Wendy. I mean, you're giving something back that's invaluable. You're giving them life skills. You're teaching them life skills, teaching them how to re-engage with their family and how to just be human again, right? It's such a natural thing for a lot of us, but it gets lost along the way. And you're definitely, if that's the best thing that you could give back, is teaching them how to just live again normally, and then being able to even give back to the point of giving them a job. I saw even Jillian's story, her becoming office manager. It's very powerful and impactful for your communities. Let's talk about that award that y'all were given, the inaugural Recovery Residents of the Year Award. Talk to us a little bit about that. What was that like?
Well, that was amazing to get that email that we had been nominated. I received a nomination, and then Dove House received the nomination. And so it was really nice for the first time in Dove House history to receive 2 important nominations, and especially the recovery residents, because we've worked so hard. The last year has been a year of transition for us again. I feel like the last 5 years, we're constantly evolving. I always laugh with my board, like, we're going to slow down and just stick with status quo. But I don't stick with status quo, and neither do my team or my board. But the last year has been a year of transition, and we've had some rough spots as we continue to evolve. And so to receive that award and to be nominated, not only from our peers, but clients, what an amazing acknowledgement of the work that we've done, and how we have broken the mold in some ways, and to receive that accolade, and to receive the inaugural award for recovery residents by the Mental Health of America of Indiana. So it was quite the honor. Absolutely.
Well, hey, Wendy, your program is unique. The things that you do are fantastic. I wish you much more success in the future. AZZLY is a strong supporter of the work that you do, and the families that you help support and get back on their feet. So anything that you'd like to leave us with lasting words, advice for any programs that are like yours, maybe struggling and looking for brighter days?
Yeah, I think, well, obviously I would welcome anyone, if they want to learn more about Dove House, to visit our website at doverecoveryhouse.org. And certainly, you know, we ask a lot of questions. We talk to the right people, but we don't give up when it's hard. Because at the end of the day, if I give up or my team gives up, then we're failing the women that need us the most in our community. And so we struggle through the difficult and we celebrate the accomplishments, and that's what keeps us going every day, is knowing that women are alive today because of the work that we've done. And so for any nonprofit recovery residents that is out there, you know, I think that the world is catching up to substance use disorder and recognizing it as a mental health issue. And so I think good things coming because of that support.
So can I ask you, Wendy, has AZZLY or any sort of technology impacted the way, you know, your services are provided now, even like capturing outcomes as well as, you know, being able to be accredited with Medicare or Medicaid?
I think what I love about AZZLY, and we looked at a lot of different, you know, electronic, you know, medical records, and AZZLY by far was the best because it really centered around a person who suffers from substance use disorder. So everything from being able to capture their image to client notes to even being able to impart urine analysis, and then exactly how it translates right back to Medicaid for billing, so we can submit claims from there. We didn't need a lot of other bells and whistles. We needed it to be good, but we needed it to be translatable to the services that we provide. And it's very user-friendly, and we love it. And I think as we continue to work things out, because we've had the AZZLY team's been great to build things out for us specific towards our needs that didn't exist. So I'm hopeful that this experience, not only for AZZLY and us, will help translate to a better user system for other recovery residences or treatment providers that come on board with AZZLY.
Thank you for your patience, because at the end of the day, it is a building out process. Mm-hmm. The right electronic health record vendor for a team like yours is going to provide a service.
Probably out of the whole team, I'm the less engaged with AZZLY because I need it for for billing purposes. But so for someone that doesn't get into it as regularly, it's super user friendly. And I know Sarah Church, our clinical director, has standing meetings every week with the AZZLY team. Anytime I'm like, hey, we need this information, you know, even today I needed something. Like I said, hey, I need to be able to pull up social security numbers in AZZLY. I should be able to do that. She's like, okay, I've got a call today with Joyce. I'll ask about that. And that's fantastic. We know we have a working partnership and relationship, and we're not getting the standard, we can't do that, or if the system doesn't do that, it's okay, let me figure out and we'll make this happen. So no, I mean, kudos to you all and your team, because it has been nothing but great for us.
Wish y'all much success. We're here for you as a corporation, and I'm here for you personally. If you ever need anything with AZZLY, please let me know or let us know. We'll handle it, Wendy.
Absolutely, and vice versa. If there's anything that we can do, or if you have clients that are in the same position as we've been, and if there's anything we can do, or if there's anything we can help your team in terms of recovery residences and transitional housing, if there's anything we can do to help or provide feedback on, please let me know.
Thank you for all you do, Wendy. We appreciate it, and we'll continue to support Dove Recovery House as much as we can. And thanks for your time today, Wendy. I think that was perfect. Was there anything that you wanted to maybe double down on or wanted to add on to that?
I didn't talk about how we'd become a Medicaid provider and that requirement.
Okay, well, let's talk about that.
So Dove House has received funding from Recovery Works, which is administered through Family Social Services out of Indiana. And it was reimbursable monies for individuals that had a current felony charge or a prior felony with a current misdemeanor, and obviously suffering from substance use disorder. So it was a nice way to just kind of add on to our cash flow. And we are accredited as a level 4 recovery residence in the state of Indiana. And the level 4 is the highest recovery residence. And that's because we have clinical on site. So one of the things I didn't mention is that we offer trauma therapy, individual therapy, where we offer IOP. So we're certified through the Department of Mental Health and Addiction to be an IOP treatment provider. And so the requirement was, if we wanted to continue to receive that funding, we must become a Medicaid provider. And we knew that it was going to be difficult. We knew that the Recovery Works funding was important to us, but we also looked at Medicaid as being another sustainable source of funding that would allow us to do even more for our clients. And so we are now in network with 2 out of the 3 that we have applied for. And we are very excited about that because this has been a year, well, now over a year in process. So we're now a Medicaid provider certified through the Department of Mental Health and Addiction and Family Social Services Administration. And again, I think that we will be able to continue to offer the really important life-saving services due to the diversification of income. And I think that goes back to kind of the government catching up a little bit. We've always been responsible for raising our own money, but recovery residences are now being looked at as a very important part of that continuum of care in a person's journey to sobriety.
This concludes our episode on Talking Treatment. Stay tuned in the coming weeks for our next release on a different topic with a new guest.